close to the nerve centre of our entire bodies. But is it the case that our lives are in the hands of dentists more than we ever thought possible? Can many modern chronic diseases be treated simply by having your teeth taken care of in a completely different way? Does such a new approach point to a protection of current methods, and if their failings were ever exposed would lead to huge lawsuits worldwide? Is it reasonable to state that profits are being put before patient health? They wouldn't do that, would they? Let's find out as we go on the edge. Welcome to On the Edge. I'm your presenter, Alex G, and tonight we are live, and that means this is your chance to interact. And here's Melissa to tell you how.
Thank you, Alex. Text in on 86686, type the word EDGE, then leave a space and put your message. And standard network charges apply, and I'm waiting to hear from you.
Thank you there, Melissa. Now my guests tonight are Graeme and Lillian Munro Hall. Welcome to On the Edge. Now you brand yourselves as holistic dentists. So can you describe to me how holistic dentistry differs from the profession that we are most familiar with?
Well, there's no strict definition of what a holistic dentist is. But what we take it is that the dentist must use the healthiest materials and methods in order to treat his patients.
I got you. So how did you start in dentistry, and when did you start to see things differently?
I started, well, I've been a dentist now for over 40 years, and I came to see things, I was just a conventional drill, bill and fill dentist.
Yeah.
I came to see things differently when just before I was 30, doctors told me to go home and die with a heart condition.
Really?
That was irreversible. And so I did go home, but rather than die, I thought, well, I'll think about this, because why should I have it at 28 when I didn't have it at 18? And that's when I found that vitamin C would actually hold the heart condition in check. And a little later on I found, in fact, I was reacting very strongly to mercury, which I was using all the time as a dentist. And it was the mercury that was causing my own particular heart problems.
Goodness. So conventional wisdom, conventional medicine had no answer to this then?
They had absolutely no idea of what it was at all. They offered no treatment. Lillian came into it through a slightly different route, but hers was equally dramatic. So
there we go, that was a big build-up for you, Lillian. The drama, what was it that immediately sort of affected you then? What was your story?
Well, I woke up at the age of 42 with a thrombosis in my arm.
Right.
And I was living a very healthy lifestyle. I was not smoking, I was not drinking, I was exercising, I was doing all the right things. And I was taking supplements as well. And of course I went to the doctor, and he started doing a lot of different tests on me. And mainly allergy testing, where he tested me for different types of molds, and he tested 52 different types. I reacted to them all, and 4 of them was extreme. And he offered no explanation to anything.
Goodness me.
Until we started doing our treatment, and Graeme took an x-ray of my mouth, and we started looking at what was there. And it so happened that I had a molar tooth I root treated about 15 years previously, maybe. And then I had a palladium crown put on it as well, later on. And that sort of slowly just spiraled my health downhill. And my liver values were just skyrocketing high, and they just didn't know what was caused by it. So we thought, well, we'll try to take the tooth out. We took it out, we cleaned the area out, we took the crown out as well. And after that, about 3 months later, my health was back to normal, and that's been fine ever since.
In just 3 months?
3 months.
Goodness me. So I mean, literally, in both your cases, conventional wisdom, conventional medicine had effectively failed you, and you found your own solution to the problem. Now, this has led on, I believe, to you developing what is obviously described as a unique detox therapy. You mentioned vitamin C there, Graeme. Certainly people are going to be surprised that something so common, so available, is the key to a lot of health and well-being. So are we talking high doses, or how does the regime work?
We're talking very high doses, and we're also talking about intravenous infusions of vitamin C. Where we will not take metal out of a person's mouth unless they're hooked up to an intravenous vitamin C infusion. And you're talking doses, depends on the condition and the patient in front of you, but it'll vary between 35 grams intravenously and might go up to 100 grams and sometimes even more at any one time. And we'll give series of these infusions.
So how did you actually discover that vitamin C was key here?
Well, I knew from my own experience that taking it orally, and I was taking 20 grams a day, kept my own symptoms in check. And then we just read and researched and went into it and found people have been doing work in other countries using intravenous vitamin C, and it's sort of fallen out of fashion.
Yeah.
And so we thought, well, the biochemistry would work as a protection against mercury, and so that's how we started.
Gotcha.
I was the first one. I was a guinea pig. I was the
So
first
you
one.
you were your own guinea pig.
I was their own guinea pig. I actually signed a disclaimer that if I died while they were doing it, then they were clear, because we just didn't know what would happen at that point.
Got you. Now you've got your book here, which I'll hold up to the camera here, which is Toxic Dentistry Exposed, which I have to admit is an absolutely fascinating read. It's one of these things that you can't put down, for the simple reason, chapter after chapter, you get more and more embroiled in how much of conventional dentistry is not actually doing any good. In fact, it's doing completely the opposite. And in fact, I should note at the beginning of your book, you say, in the provisos, the contents of the book do not reflect mainstream opinion of either medicine or dentistry, at least not yet. So that sounds like you're in a constant battle with, dare I say, the establishment in terms of what you are suggesting here. So what is their reaction to the philosophy and the methods that you are using?
Well, obviously they're not happy about it, and they have had several goes, of course, to try to get our license offers to practice, but they really have very little to go by, because we are following the science, and when you start looking at the different aspects of it, it's not as if we just draw something out of a hat saying, well, let's try a bit of this. It's all science-based, and that is really what we in our naivety thought when we went to dental school was, excuse me, that they actually wanted to try to find out about the truth and not necessarily just doing what they did. So when the